Good day, I am Izdimay Del Rosario from BSN 111B, Group 6. And today I am going to perform open gloving return demonstration. So wearing gloves is very important because it can help both the patient and the health workers from being contaminated or infected. This also keep our hands clean, and it also lessens the chance of getting microorganisms that can make us sick. Always remember that wearing gloves does not replace hand washing, and so we must perform hand hygiene before and after this procedure. So I am going to perform first hand washing. So now that I'm done doing hand washing, I can now proceed with the procedure. So first things first, prepare the materials needed in this procedure. So I have here my sterile gloves and of course a trash can over here. Next is to inspect the package for tears or stains to ensure the sterility of the gloves. Next is to get the correct size of the gloves. So the gloves must fit properly so that it is comfortable to wear. So in my case, I am size 6 and 1/2. And as I can observe, the package of the gloves is all intact and there are no signs of tears or stains that can affect the sterility of the glove. So now I am going to start. So to start off, we need to peel carefully the side of the package. So peel it carefully without contaminating the inside package. Now I am going to grasp the inside. I am going to grasp now the inside wrapper and place it on a clean, dry, flat surface because any moisture on the surface could lead to the contamination of our sterile gloves. Also, make sure to put it on our waist level because any object held below our waist level is considered to be contaminated. So I will now put it. Next, I am going to open now the inside wrapper of the package and identify the left and right glove. So for easier application, make sure to put the first glove on our dominant hand. So since I am right-handed, I am going to put the first glove on my right hand. So using my thumb and two first fingers on my left hand, I am going to grasp the inside cuff of the right glove. So our hands are not sterile, so we must only touch the inside part of the gloves to avoid contaminating the sterile gloves. So I am now going to insert my dominant hand. Make sure to keep our thumb against our palm to avoid touching the sterile side of the gloves and to avoid contaminating it. So I am inserting it now. So now that I already inserted the glove on my dominant hand, I will now proceed on my non-dominant hand. So using my dominant hand, I am going to insert my fingers beneath the cuff on the left glove, making sure to only touch the sterile side of the glove to avoid contamination. So make sure to insert it. Okay, just like that. And keep your thumb against the palm to avoid touching the sterile side of the glove. So now that I already gloved both of my hands, I can now adjust the glove so that it fits smoothly into my hand. So make sure to only touch the sterile side of the glove to avoid any contamination. Now, I am going to interlock my finger and put my hand 6 inches away from my clothing to avoid accidental touching of non-sterile gloves or a non-sterile object. Also, put our hands above the waist level and below the shoulder level to avoid any contamination. So that's it. So for the removal of the gloves, I am going to remove first the gloves on my dominant hand. So using my non-dominant hand, I am going to pinch the palm area of the gloves in my dominant hand. Pinch it and carefully remove it. And place it on our non-dominant hand. Place the gloves on our non-dominant hand. Then now that I already ungloved my dominant hand, I am now going to insert my fingers on the glove on my non-dominant hand, making sure to only touch the inside part of the glove to avoid contaminating our ungloved hand. And remove it carefully, just like that. And I am going to put it on the wrapper, fold it, and throw it properly. Now, I am going to do hand washing to remove powder from the gloves to avoid any irritation and also to prevent contamination from any potential pinholes from the gloves. So I am just going to do hand washing. So now that I'm done doing hand washing, this also ends my open gloving return demonstration.